Hello, my name is Dana Vitale, and I would like to thank you for the opportunity of allowing my proposal for implementation of an electronic health record. Currently, I am the Associate Director for Hackensack University Medical Center, a 300-bed facility. Hackensack University Medical Center has been rated #1 in the state of New Jersey in the last year. However, there is room for improvement. First, let us review our financials for the last year. The facility has seen 1.5 million patients with the opportunity to see an additional 5 to 10% increase in patient volume next year. The facility has a $2.25 billion operating expense budget. Patient safety is essential for our facility and should be an organizational goal. Our consumers are top priority at the facility, and we want to be assured that they will come to us for treatments and they will recommend us for family and friends. Recently, it has been brought to my attention that patients are frustrated that they have to bring their paper records to the hospital, are being billed for duplicate testing. Additionally, patients complain that physicians and nurses are in a hurry and don't follow up. Finally, they are complaining that their communication within the hospital is not done appropriately. The advancement of a medical record, the electronic health record can greatly reduce these risks. All doctors within the facility and outpatient offices will have the opportunity to have access to patient records inside the hospital and in the office. Patients will no longer have the burden of producing copies of needed results. Doctors can now have streamlined care across multiple disciplines throughout the hospital. Barcoding can be implemented to increase patient safety, reduce the risk of wrong med or allergic reaction with alerts from the computer. Right now, test results take hours, days, weeks to come back. With an electronic health record, doctors can have access to test results almost instantaneously, being sure that appropriate interventions can be applied immediately. Moreover, the computers can generate charts and graphs to make it easier to monitor trends. Lastly, there has been a delay in follow-up appointments with patients after discharge, thus causing more readmissions. Computers can assist with discharge instructions, allowing doctors and nurses to schedule follow-up appointments, e-scribe medications, and provide information on treatments to help reduce readmissions. Equally important, the electronic health record can aid in billing. The computers will be set up for the right diagnostic codes to be implemented, which can improve payments. Billing will now be able to be submitted electronically for faster turnaround times. The electronic health record can ensure that doctors are inserting the right diagnosis to go with the right treatments. The implementation of the EHR will improve patient safety, streamline patient care, reduce costs, and improve financing for the facility. In conclusion, in the last fiscal year, Medicare has paid 33%, private insurance pays 33%, and self-pay plans pay 33%, with final 1% being charity care. Patient safety is the most important aspect of patient care and can help reduce the risks of malpractice lawsuits. The implementation of an EHR can improve patient safety. The implementation of barcode scanning can save thousands of lives each year from wrong medication administration. Streamlining patient care across the different domains can help reduce duplicate testing and improve patient care. This gives doctors the time that they need to spend with patients. Additionally, the EHR can make communication amongst patients and other healthcare providers easily. Finally, billing can be improved with faster returns from insurance companies, correct diagnosis codes being entered the first time. The cost of the electronic health record may seem high, but the benefits outweigh the risk. I'd like to thank you for your time, and I hope you consider my proposal.